ପ୍ରଦାନ କରୁଛନ୍ତି। ଡକ୍ଟର ମୁରଲୀ ମନୋହର ଯୋଶୀଙ୍କୁ माननीय प्रधानमंत्री बोताम
आसमान में बादल छाए हैं, लेकिन धरती पर धूप फैली हुई है। हम प्रकृति से प्रार्थना करते हैं कि इस समय आकाश और धरती का मेल जल्दी नहीं होना चाहिए। उड़ीसा बहुत दिनों बाद आने का मौका मिला है, मगर उड़ीसा के लोगों के प्रति मेरे मन में गहरा आदर है। झंझावात के दिनों में मैंने देखा जब प्रकृति ने उड़ीसा की परीक्षा ली थी, जब साइक्लोन आया था, ऐसा लगता था कि नई जिंदगी की शुरुआत करने में बड़ी मुश्किल होगी। लेकिन मैं बधाई देता हूं उड़ीसा के लोगों को, यहाँ की सरकार को, यहाँ के शासन को, प्रशासन को, नौजवानों को, कि उन्होंने प्रकृति से डटकर मुकाबला किया, हार नहीं मानी। अब फिर से उड़ीसा, नया उड़ीसा खड़ा हो रहा है, आचरण से खड़ा हो रहा है।
Good evening. Welcome and thank you for joining us in celebrating the 8th Foundation Day celebrations of AIIMS Bhubaneswar on a virtual platform. The foundation stone for AIIMS Bhubaneswar was laid by the late Prime Minister Bharat Ratna Atal Bihari Vajpayee ji on 15th July 2003. The institute started functioning in 2012 and therefore this is our 8th year and we celebrate this day with pride. Normally on a Foundation Day celebrations, as the director of AIIMS Bhubaneswar, I get to talk to you about the year gone by and review our progress in the last 1 year. However, this year we have made videos which have been prepared by the various departments and they will be showcasing all their successes for all of you to see and enjoy on this virtual platform. These have been very difficult times. However, I appreciate and praise the dedication and the hard work which has been put in by each and every member of our institution. The faculty, residents, students, administration, housekeeping, security, every division has shown how they can function in difficult times and they have come up and done what they do best, that is, serve the people of Odisha to the best of their ability. The footfall in our OPD as well as our casualty shows the trust and faith that people of Odisha as well as the neighboring states have in us since they come to us for their health care. And therefore, it is our pride and privilege to serve these people with all our heart and mind and what we do best. And I have the deepest appreciation for all of you on this day. Thank you, and let's see and enjoy the feast which we have before us today.
Hello everyone. As you know, we celebrate our Foundation Day on 15th July of every year. This is the 8th Foundation Day. On eve of this, I congratulate each and one of you who are associated with AIIMS family. As you know, we are progressing well since the inception, and over the last 2 to 3 years, we have progressed very well under the leadership of our director, Madam Gitanjali. Having said this, last year, if you remember, we had our Foundation Day very well, but this time because of this COVID crisis, we are going for online mode. Yes, because I am heading the hospital, I would like to give some hospital statistics for the reference of all of you. As you know, as per the provision, we need to have 25 modular OTs, but we have started 15 modular OTs already, and the rest 10 is going to be started very soon. And regarding the ICU, we were planned to have 112 ICUs, but at present we are having 67 ICU beds of all categories. And the Department of Nephrology and Department of Gastroenterology, they have started with good faculties. The nephrology, they have started dialysis with 14 machines, and a new faculty who had started this gastrosurgery department, he has started operating very complex surgeries as well. Currently we have 922 functional beds with 40 disaster beds. As far as the patient load is concerned, as you know, we used to have almost 4,500 to 5,000 patients per day, but because of this COVID, now the patient load has come down to almost half. But to overcome the crisis of COVID, we have started the telemedicine department in almost all the departments, and we have started a new app, that is AIIMS Bhubaneswar Swasthya app, for the betterment of the people. In addition to this, we have started many projects under CSR funding. One is our patient attendance rate set funded by NALCO, and burn center funded by NTPC, trauma, second degree trauma center by Petronet, and we have many MOUs with Airport Authority of India for supplying ventilators to our trauma and emergency department. We have a beautiful ambulance, ALS ambulance, given by the SBI of India. In addition to this, there are many more people and many more organizations also. They have supported or contributed depending on their capacity to the building of AIIMS. Having said this, we have also started this control room and May I Help You center 24/7, so that as and when required, people can contact them directly, both those who are inside and outside, to cater to their needs. We are associated with many state government projects and central government projects, BSKY, RBSK, Ayushman Bharat, and some international projects like Smile Train, which are being operated in AIIMS Bhubaneswar since quite a few days. And I said that we are in the path of growth. We are growing very well. Only this is a temporary phase of COVID area. Otherwise, we would have been somewhere else by now. Again, my best wishes for this 8th Foundation Day, and hope that it will bring much more joy to the people of AIIMS, those who are associated directly or indirectly with AIIMS institution. Thank you.
From June 2013 till July 2020, the department has tried to establish itself and gain confidence of our patients. Here we present our activities for last 1 year, that is July 2019 to July 2020. During this time, the department has provided service to 38,296 patients, out of which 4,794 patients were new registration. 10,538 number of radiotherapy treatments have been done by high energy linear accelerator, whereas 181 treatments have been done by HDR brachytherapy. A total number of 6,001 patients have been provided daycare service. The department has added a spectrum of various services to needy cancer patients in form of OPD, IPD, daycare, screening, hospital-based cancer registry, family cancer registry, etc. Inside the department, always it is our endeavor to provide standard of care for patients as well as students with a difference. After addition of a high energy linear accelerator, high dose rate brachytherapy and CT simulator to the armory, the department became fully functional in true sense. All patients are being treated with conformal form of radiotherapy only. As a feather in the cap, the teaching program began with joining of first MD and MTRT students in 2019. Before this, the department had initiated fellowship program in palliative medicine from 2018. The department is indulged into patient care, clinical research and teaching activities. Over last 1 year, the department has published 8 articles in various international and national journals. The faculty members are having wide range of experiences from prestigious INIs, both inside and outside country. They are members in various state government policy making bodies and also postgraduate teachers in various reputed institutes. The department is trying to render full spectrum of services as per the mandate of the institute with a human approach and trying to relieve suffering and grief of cancer patients scientifically with modern technology. Greek philosopher Aristotle had once told, "We are what we repeatedly do. Excellence, then, is not an act but a habit." We are confident that we shall expand and excel in providing value-added service to our patients as well as to our curriculum.
First of all, my best wishes to all of you on this happy occasion of 8th Institute Day. This institute started its official functioning on 15th July 2012. Now, this 8-year-old, our predecessors, they rendered a great service due to their hard work and also dedication of existing faculty, residents and staff members. We have achieved a lot of success during this 8 years. So, although we are 8-year-old child, but people now treated us as an adult where the expectations are huge, and we have been provided with various mentoring activities. I hope with all your effort, dedication, hard work, the institute will go further high. It will add more laurels, and very soon it will be turned into one of the best institute in the country. Then this is a very difficult time. I also take this opportunity to pay my respect and convey my sincere thanks to all our faculty members, resident doctors, nursing officers, other staff, the security, the housekeeping staff who are fighting this COVID crisis. So during this difficult 3 months period, our people, specifically our doctors, nursing officers and others, they have rendered a marvelous service of patient care for the benefit of the people. And by this effort, more than 1 lakh people got benefits, where all other hospitals kept their OPD and other services closed. This is really a great achievement and sacrifice on the part of our doctors and nursing officers. I salute them. Lastly, I pray Lord Jagannath that next Institute Day we should celebrate together by, with His grace, this COVID sorrows and pandemic will go away next year. Thank you very much. Please stay safe and take all precaution during this time to be healthy and safe. Thank you very much.
Hello everyone, my very warm greetings to all the faculty, staff and students of this prestigious institute in celebrating 8th Foundation Day. The institute has grown up from being one of few new AIIMS apart from AIIMS New Delhi in its formative year to being one of the most sought after medical college hospital in this part of India. Me and my entire team of examination cell take pride in contributing to this process of evolution of AIIMS Bhubaneswar. Here I will tell some of the milestones which our student achieved during last 1 year. 25 numbers of our MBBS students and 23 of our BSc nursing student and 3 numbers of our paramedical student have cracked all India postgraduate examination conducted by various INIs like AIIMS Delhi, PGI Chandigarh and BSc paramedical student, particularly they achieved in IIT Roorkee and PGI Chandigarh examination. One of our student, Dr. Vinita K of 2014 MBBS batch secured first rank in the AIIMS PG examination. This is instill a sense of contentment to all of us. This speaks that our evaluation process is moving in right direction and we continue our sustained effort further movement. We have supported the institute in augmenting the strength of senior and junior resident. During the last 1 year, we have recruited 37 senior resident and 65 junior resident. Exam cells has been also helping the administration for various faculty and non-faculty recruitment both in AIIMS Bhubaneswar and AIIMS Kalyani. One thing I want to tell here, during this COVID-19 pandemic has created so much panic around worldwide and also in India regarding various examination process conducted by medical institute around the country. We are here, AIIMS Bhubaneswar have successfully conducted exit professional examination of MD, MS, DM, MCH examination and also supplementary examination as per guidelines framed by Government of Odisha and India even before it has been conducted by various institutes including AIIMS New Delhi. And also I want to tell you the process which we have followed is same as that of the guidelines framed by the MCI much after the examination we have conducted. We are now in the process of implementing National Academic Depository promoted by UGC Government of India. We have successfully completed all MBBS, BSc Nursing, paramedical students. The examination cell once again wishes AIIMS Bhubaneswar on its 8th Foundation Day and wish to put forth our continued committed effort in the excellence of the Jai Hind.
The journey of the Department of Obstetrics and Gynecology since the last Foundation Day has been kaleidoscopic, with the entire department leaving no stone unturned to reach milestones in quality healthcare, medical education and research. Several life-saving surgeries performed timely and efficiently have countered near misses and averted maternal mortality. Many challenging cases with diagnostic dilemma and therapeutic conundrums have been managed optimally with evidence-based medicine and multidisciplinary team approach. Knowledge increases by sharing, as evident from the active participation of our faculty and residents in various conferences, presenting papers, delivering talks, and winning quizzes. Research is formalized curiosity, Our inquisitive minds have resulted in 26 publications in the last 1 year and have motivated us to do COVID-related projects. Our baby steps continue, and we pledge to strive hard to achieve excellence in all realms which exemplify an institute of national importance.
The Pediatric Surgery Department of AIIMS Bhubaneswar has accomplished many milestones and is marching ahead. During the last year, the department has delivered its expert services to many outpatients. The inpatient services can boast of treating more than 1,000 satisfied patients. The pediatric surgery ward has been judged as the best ward on the last annual day. The department has carried out many 360 surgeries within the last year, many of which are first in the state and region of the country, like neonatal laparoscopy, Wilms tumor with IVC thrombus. Many complicated surgeries have been performed like extrophy epispadias complex, traumatic posterior urethra repair, etc. The department has set up a state-of-the-art pediatric urodynamic laboratory which is first of its kind in the state. The pediatric nephrourology clinic is running successfully with more than 150 patients registered in it and availing the follow-up services. The department has many research activities in the form of intramural funded projects and extramural funded projects in collaboration with ICMR. During the last year, the department has published 14 publications in national and international journals, and many are under consideration for the same. Many more activities are in pipeline and the department is in the way of progress.
The research section at AIIMS Bhubaneswar fulfills one of the three main aims of the institute, that is research, patient care and training. Over the last few years, several research projects have been on the anvil. Now we have around 60 extramural funded projects, 124 intramural projects and 248 non-funded projects. The funding entirely amounting to around 16.3 crores, a large chunk of which has come in the last financial year itself. The students have been involved in research and nearly 37 projects have been passed by the ICMR for execution in the last year. PhD courses have started in several sections. All this has spawned a number of publications running into nearly 600 odd publications from the faculty. Recently, with the onset of COVID, there has been a surge in research activities pertaining to COVID. Courses are being conducted, instructive courses in the research section. The last year we have had courses on literature search, on reference management, managers, and biostatistics at the departmental levels. The research methodology courses are also on the anvil in consort with the Indian Society for Clinical Research, and they will soon take off. The research section has been reconstituted with its dean, associate dean and faculty in charges. The members of the different committees, the scientific evaluation committee, the ethics committee, the stem cell committee, the clinical, the subcommittee for clinical regulatory trials have all been reconstituted in the last year with a fresh set of personnel. At the level of technical platforms, we have introduced several, like the technical platform for the Institute Ethics Committee, the software for that, the software for accounting, the SFACTS, the plagiarism software, Turnitin, and so on. So with this, we are set to take on new projects. In fact, in the last year, a major project to create a Center for Excellence in Clinical Microbiome Research has come in with a large grant. Thank you so much.
Rehabilitation is the continuous process of helping a disabled person to restore lost skills and achieve maximum functional independence. It is a teamwork done by our small team of PMR comprising of qualified physiatrist, physiotherapist, occupational therapist and PNO. In the past 1 year, we had a total of 19,623 cases with around 8,600 new cases. Out of all the OPD cases, 334 patients were admitted for rehabilitation purposes. 242 rehab surgeries like Irizarov tendon transfer were done. Pain interventions like ultrasound guided MSK injections of steroids, medical ozone, epidural steroid injection as well as Ponsonby technique for CTEV were performed in the past 1 year. Spinal cord injury, stroke, cerebral palsy, traumatic brain injury patients were admitted in our ward and underwent neurorehabilitation by our entire team. Various projects are on the way at present, including the novel Botox injection in chronic low back pain patients. PMR team led by our faculty and SR made us proud with their personal awards in various national and international conferences. Postgraduate trainees are our academic gems who are regularly involved in surgeries, pain interventions and casting procedures as a part of the EPA. Along with these other activities like PMR modular OT inauguration, oath taking, Teachers Day celebration were performed in the past 1 year. One of the rehab success story is a boy with deformity was able to go to school after deformity correction surgery and associated rehabilitation. In these COVID times, we are not behind as we performed COVID duties as a frontline warrior. So finally a well-deserved eventful year for our department, and as we say, rehabilitation continues.
Good evening everybody. It is a proud privilege for me to tell something on this auspicious day, on our 8th Foundation Day, which we are celebrating through virtual platform on this day. I congratulate each member of our AIIMS Bhubaneswar family, especially our President of our institute, our Director Ma'am, our Deputy Director, Medical Superintendent, all 3 Deans, all the faculty, our nursing officers, Principal College of Nursing, nursing staff and all paramedical staff and also our beloved students on this special day. Any medical college is known by 2 things. One is the patient care and the academic standard. And I take this opportunity to tell that so far as our patient care is concerned, just before this pandemic, we touched the footfall of almost 4,000 per day to our hospital. And so far as academics is concerned, after joining of our Director Ma'am, she has entirely changed the syllabus of all courses, that is our undergraduate courses, postgraduate courses and also the super specialty courses. And the result of that we have also got by our result of the last postgraduate entrance examination of all India by bagging the first position. Our student of 2014 MBBS batch, Dr. Vinita K, she topped the entire all India PG courses entrance examination, and also total 27 students of our AIIMS Bhubaneswar ranked in all India entrance, not only in AIIMS New Delhi, rather in PGI and JIPMER also. And let me take this opportunity to tell each one of you that 27% of our MBBS students, they cracked the all India entrance examination for postgraduate admission, and 38% of our BSc nursing students of AIIMS Bhubaneswar also cracked in all India MSc nursing entrance examination also. So this speaks volume of our academic standard, and definitely this day we remember all the efforts which was done by every one of our member, and definitely we take this also opportunity to rededicate ourselves, to commit ourselves for the future development of our institute, by which all the 6 new AIIMS which is set up after AIIMS New Delhi, the AIIMS Bhubaneswar has been leading in the front and will also be in the front in the days to come. We rededicate ourselves on this day for a better future of our institute, for patient care as well as academically we will prove ourselves once again. I thank all the members and I congratulate also all the members of our AIIMS Bhubaneswar family on this day. Thank you very much and have a good day.
Good morning. We are few in number, but we work as a team. Here we are. This year we have added intervention part of endoscopy to our existing diagnostic modalities. The most exciting part of the journey is ERCP. Director Madam is kind enough to facilitate the whole process and inaugurate the facility. These are highly skilled procedures and very few centers at the facility, while we utilize the large stone inside the liver, break it into the pieces using electrohydroenergy source and remove it to avoid a highly complex surgery. Here is another example of providing palliative comfort to a terminally ill cancer patient. ERCP has made it possible to deploy a self-expendable metallic stent to cure the jaundice in those patients. Another, again, the technique and technology came into the rescue of cancer patients, stent relieving the obstruction at the gastric outlet, thus enabling the patient to eat normally. Saving the patient from repeated blood transfusions showing burning the bleeding vascular lesions in the stomach. This is a hybrid technology where endoscopy and ultrasound are fused to the human advantage, acquiring the tissue through the endoscopic ultrasound guidance to reach at the diagnosis early. Endoscopic ultrasound guided drainage of a large intra-abdominal necrotic mass being drained using EOS technology, saving the patient from a high-risk surgery. One of our interesting clinical cases was shortlisted by the APDW Academic Committee for oral presentation. Only 3 cases have been shortlisted out of 400 plus entries from India and abroad. We were among the shortlisted. In addition, 2 more oral papers were also accepted for the presentation. We had 2 eminent visiting faculties this year from AIIMS New Delhi and Australia. These are the various research projects, including extramural and DM thesis projects. Not only quality, but quantity also matters for us, who do not want to disappoint any of our patients. GE Super Specialty has seen highest number of patients compared to other super specialties. Thank you.
We have significantly increased the biopsies done for the diagnostic and therapeutic purpose. Last year, we have done more than 1100 biopsies. We are gradually increasing the cosmetic procedures such as vitiligo surgery and derma roller. Last year, we installed a new radiofrequency cutlery machine. It is being regularly used for removal of viral warts, skin tags, and seborrheic keratosis. We have started doing patch tests for patients of hand eczema and allergic contact dermatitis, which is used to find out the exact allergen causing the same condition. Patients with excessive palm and sole sweating are being treated by using this iontophoresis machine. Two new academic junior residents have joined in our department in last academic year. Dr. Sasmita Misra and Dr. Parvati Biswan. At present, we have 4 academic JRs are working in our department. We have started a site laboratory room in our OPD premises, which is used for routine examinations and PG teaching. Following articles have been published in international as well as national journals from our department.
A very good morning to all of you. I congratulate each one of you. 1330 students, 195 members of the faculty, the staff, the director who is leading the team so very efficiently, and all the team members of the director. on the completion of yet another very successful year. Congratulations on 8th Foundation Day. I wish I could be there in person to congratulate each one of you. But unfortunately, we are in COVID-19 situation, and webinar and talks like these are the new normal. And conforming to the new standards, I am talking to you through this method. The other day, I requested the director, Dr. Gitanjali, a very capable director who has been actually spearheading the whole team since 2016. I requested her to let me go through the journey of AIIMS. And she, of course, sent me a couple of papers. It talked of the journey since 2003, when ex-Prime Minister Honorable Atal Bihari Vajpayee had laid the foundation stone of AIIMS Bhubaneswar till date. And what a wonderful journey it has been. Yesterday evening I was going through all the papers that had been given to me by her, and I was charmed by the way AIIMS Bhubaneswar has been built bit by bit, brick by brick. Amazing it is. Amazing journey it has been, and it's a great example of wonderful teamwork. Good research is going on, very good medical education is being imparted, and what kind of service you are rendering to the people of my constituency, Bhubaneswar parliamentary constituency, and much beyond that is unimaginable. People like us who are people's representatives, who are in touch with people day in and day out, they know what kind of service you all are rendering. As the representative of Bhubaneswar parliamentary constituency, I need to profusely thank the faculty members, the staff, and all of you who are associated with rendering public service for doing a great job. 8th Foundation Day. Now, this particular day, I would definitely say it's a day of not only celebration, but also to sit still and look back. What have you achieved so far? It's amazing. And in the days to come, you may achieve much more. My best wishes are with each one of you. I'm reminded of the words of H.W. Longfellow, who had written in A Psalm of Life, a beautiful poem. He said, "Art is long and time is fleeting, and our hearts, though stout and brave, still like muffled drums are beating funeral marches to the grave." We really need to perfect that art, the art of public service. I always tell people I have come to politics for public policy and public service. And public service, to my mind, is the best form of politics, and public service should be integrated with the lives of each one of us. You all are rendering great public service. I congratulate each one of you. And last time, when I had gone on the 7th Foundation Day, I had ended my speech with 3 lines. I would be reiterating. Please bear with me. At the cost of being repetitive, I will be ending my speech with the same 3-4 lines. Good, better, best. Never let it rest till your good is better and your better best. Good has to be better, better has to be the best. AIIMS Bhubaneswar deserves to be the best AIIMS in the country. My best wishes. Thank you so much. Namaskar.
I'm happy to learn that the 8th Foundation Day of the AIIMS Bhubaneswar would be celebrated on the 15th of this month. It's actually a momentous occasion for not only AIIMS but for the entire people of the state of Orissa, because an institution of the caliber and standing of AIIMS, which got established in 2013, has now come up, and in a very significant way, I believe, compared to the other AIIMS. And that's all because of the hard work and the dedication that has been put in by everyone, particularly the faculty, the students, the doctors, the nurses, the paramedics, and all those who have contributed in their own way for the success full operation and installation of various wards in the AIIMS. Of course, these are very difficult times, as we all know. It's something which the world had never seen in the last 100 years. During these times, the role played by AIIMS has been extremely praiseworthy. They have been with the government in standing shoulder to shoulder to face this challenge. I am grateful to them. I wish them all the best in the future endeavor. All the best.
The Department of Radiodiagnosis is ever ready to provide routine as well as emergency services, not only to the people of Odisha but also to the neighbouring states with its state-of-the-art equipment and expert faculties. The departmental statistics of the multitude of various radiological investigations and procedures which our much-awaited state-of-the-art 3 Tesla MRI was inaugurated on 7th Foundation Day of AIIMS Bhubaneswar. Our 3 Tesla MRI grabbed the Best OPD prize for the year 2019. Our first postgraduate MD examination was successfully conducted in October 2019. The Honorable Health Minister Dr. Harsh Vardhan inaugurated the advanced digital radiography with fluoroscopy machine in the august presence of other eminent personalities. The convocation of our first batch of postgraduate and MTR students, where Mr. Navneet Kumar was awarded the gold medal for academic excellence. 2 of our MTR students have brought laurels to the department by getting selected in MSc courses in reputed institutions like AIIMS New Delhi and BARC Mumbai. Our junior residents participated and did poster presentations in the Odisha State Radiological Conference 2020, and one of our students, Dr. Siladitya Mahanti, won the second prize in radiology quiz. 2 of our senior residents secured ranks 1st and 6th respectively in NEET super specialty and went on to pursue DM in interventional radiology. In the HOD of the department, Dr. Bag was invited to the chair to contribute as an expert panelist in the Breast Cancer Updates 2019. The department conducted a workshop on breast biopsy in the conference of the Asian Society of Mastology in November 2019. Apart from the regular intra-departmental academic activities like seminars, case presentations and journal clubs, we also conduct regular inter-departmental academic meets with various specialities. Professor Dr. Bag was invited as an external examiner to conduct the radiodiagnosis PG examination in JIPMA and in SAB Medical College. Another feather was added to our cap by starting the vascular interventional procedures like diagnostic angiography, hepatic artery coil embolization and transarterial chemoembolization. The department is constantly involved in research and publication with many funded and non-funded intramural as well as extramural projects with interdepartmental collaboration. The various publications to the department's credit are
The Department of Transmission Medicine has grown in leaps and bounds since last few years. The department, besides providing the routine services, it has started delivering some advanced procedures such as therapeutic plasma exchange, therapeutic red cell exchange, and leukapheresis for the benefit of different kinds of patients. Implementation of chemiluminescence facility for transmission transmitted infectious testing is another important initiative taken by the department. In addition, enhancement of blood component preparation has been achieved with the installation of new additional refrigerated blood bag centrifuge. Our department has started implementing e-Raktkosh portal for display of available blood components in the national web platform. The department has also implemented paperless online reporting for different immunohematological tests through HIS. Most importantly, department has started MD curriculum in transmission medicine since July 2019 with a capacity of 1 postgraduate seat per year. Till date, 2 candidates have joined as a postgraduate resident and pursuing their MD degrees. The department has also been involved in both intramural and extramural research activities and publishing research papers in different peer-reviewed journals.
Good evening, friends. I must take this opportunity of the 8th Foundation Day of All India Institute of Medical Sciences at Bhubaneswar to congratulate all the faculty, the director, the deputy director of administration, the whole staff, the nurses, the karmacharis, the students, and all other paramedical and medical faculties. AIIMS Bhubaneswar celebrates its Foundation Day on 15th of July because our former Prime Minister Atal Bihari Vajpayee ji laid the foundation stone on this day. And we started the AIIMS Bhubaneswar in 2012. This is the 8th Foundation Day. During this almost a decade of establishment of AIIMS functioning, AIIMS Bhubaneswar has taken rapid strides, which is very evident by the students who are graduating from this institute, who are in competitive examinations securing top position all over the country, making AIIMS Bhubaneswar proud. Needless to say, this success and the fame the students have brought in is because of the dedicated faculty we have. The faculty at AIIMS Bhubaneswar is young, dynamic, dedicated and committed. I must take this opportunity therefore to convey my heartfelt gratitude and thanks to all of you for achieving and getting AIIMS Bhubaneswar into a progressive path. I wish you best, and I wish you will continue this degree of commitment and train your next generation to be outstanding doctors, physicians and scientists to contribute immensely to development of medical science in all the 3 fields, that is education, research and services, for which AIIMS is given mandate for the nation. Best of luck and best wishes. Thank you very much. Sufficient?
Welcome to Department of Pharmacology. Since 2013, we are actively involved in teaching and research. Recently, we have started providing services for patient care also. Our faculty members are involved in research in different domains like pain, neuropsychopharmacology, pharmacoepidemiology, artificial intelligence and pharmacometrics, and cardiovascular pharmacology. Recently, we have published our research works in reputed peer-reviewed journals like the NEE, European Neuropsychopharmacology, European Journal of Gastroenterology and Hepatology, Journal of Clinical Neurology, Journal of Clinical Psychopharmacology, Journal of Psychiatric Research, etc. We have established Adverse Drug Reaction Monitoring Center under Pharmacovigilance Program of India. We have been given access to the software VisiFlow, through which we are communicating the reports of different adverse drug reactions from different clinical departments. We have also established Medical Device Monitoring Center under Metrovigilance Program of India. Our Therapeutic Drug Monitoring Clinic is ready to provide services. We will start reporting as soon as the pharmacology module is incorporated in hospital information system. Initially, we will start our TDM services by estimating serum phenytoin, serum valproate, and serum carbamazepine. Our services will help the Department of Psychiatry and Neurology significantly. We are also ready to start the super specialty course, that is DM in Clinical Pharmacology. All faculty members, residents and staffs of our department convey our heartfelt gratitude to the administration for their cooperation.
Happy Foundation Day to the AIIMS Bhubaneswar family. We shall now present the achievements of the Department of Community Medicine and Family Medicine in the past 1 year. The department consists of 8 faculty members, 21 residents and 25 support staff in the peripheral centers and the clinics in the hospital. Overall, we have seen more than 1,50,000 patients in the OPDs alone. This excludes those who have received treatment in the community and field services. Some of the special activities we have conducted include observance of various health days. We also have many new teaching and training components. Our department has 24 ongoing projects. One of our postgraduate students have been awarded ICMR grant for his thesis, and we have a total of 32 publications in the past year. We also have published multiple modules, book chapters and reports. One of the significant initiatives of our department in the past year has been conducting the first National Symposium on Education and Practice in Community Medicine in the month of November 2019. We also organized the 38th Annual Conference of IAPSM Odisha State Branch on the month of January 2020. Our faculty and residents have presented over 14 research papers and posters at national and international conferences. Our ex-HOD, Professor Vikas Bhatia, has been honored with Dr. K. N. Rao Memorial Oration at 64th IPHACon 2020 at AIIMS, New Delhi. Besides that, our residents have also won multiple prizes and awards at various conferences. Lately, our department has been actively involved in many COVID-19 related activities in the hospitals as well as in the peripheral centers. With all the constraints that COVID-19 has brought about, we will still march ahead with all our might. And we get such determination by success, such as what our ex-HOD achieved when he became the Executive Director of AIIMS BB-Nagar. Thank you.
I welcome you all to the Department of Forensic Medicine and Toxicology, AIIMS Bhubaneswar. The department has various research activities which were published in journals of national and international repute. Department has conducted various CMEs and workshops which not only gave the benefit to the in-house students, but other medical college students also got benefit. Our faculties have been invited by various organizations to give expert lectures on various fields, out of which many police officials and medical officers working in suburbs got benefits. The department has developed a good infrastructure and did expansion so that the various postgraduate students who are being enrolled got benefit out of it. The students have performed quite well at various levels. During this current pandemic period of COVID-19, the Department of Forensic Medicine and Toxicology have been working day in and day out. We would like to thank respected Director Madam and Medical Administration to provide us with the dedicated cold storage chamber for the COVID-19 disease. The statistics of the dead body handling during this period. Thank you all.
I attribute my success to this. I never gave or took an excuse. As said by Florence Nightingale words, we always do utmost professional responsibility, compassion, teamwork, passionate, dedicated and holistic approach towards the patient care. Yes, we are AIIMS Bhubaneswar nurses. Nursing administration managed by Chief Nursing Officer, Nursing Superintendent, Deputy Nursing Superintendent, Assistant Nursing Superintendent and Nursing Supervisor. Little drops of water makes a mighty ocean. The same way we made smaller things into bigger. Here some of our achievements. We set well-planned ICU as per the hospital protocol includes nursing station, door and windows glass framing, bedsheet linen color coding, etc. We follow regular staff placement, staff training and staff rotation. Consistent staff supervision by nursing supervisors, regular audit by audit committee members and expert from other hospitals. We get higher compliances in infection control practices and less number of bedsore incidences. And we get appreciation for the same from the higher authority. More than 150 CNE has been conducted so far by nursing officers, in charges, ICN and nursing supervisors. We do regular meeting with nursing officers for quality improvement. We involve nursing officers in workshop also. Separate OT and ICU have been set to manage COVID-19 pandemic. We conducted webinar on COVID management for Odisha nurses by our faculty and senior nursing officers. Around 5,000 nursing officers have attended. We do arranged ration for needy people during COVID situation. With every seconds and minutes, we nurses are always there for heart and soul care. We serve for the patient, we serve for the nation. Let's fight against Corona and save the nation. Thank you.